All right. Well, welcome back, Dr. Jenny, to Pretty Young and Motivated, our sex ed for the girls. It's been a while. We had intended to do like a series of this, but life happened. And I think we all can understand that the last year plus has been absolutely insane. So I'm excited to have you back on and discuss more about hormones and periods and all things being a girl.
Yeah,
So
thank you for having me again. I'm excited.
yeah, so we can try to keep this going now. We decided to switch to a video. The live events is fun, but I figured, everybody can watch this then on their own terms and when they're available. So yeah, we are going to be talking about hormones and birth control today and just kind of in that general realm. So for today's form of this, I guess we're going to just go through some questions that we had people submit through Instagram. And then honestly, I just came up with questions from my own journey to like ask, and I know that I've had along the way. So we'll just go through some questions and Dr. Jenny will give her response. All
Yeah,
right.
there's tons we can talk about. I think we
Yeah.
just narrowed it down to birth control because so many people had questions last time. So,
Personally getting into it, birth control is something I started to realize that there was like so many, I guess, unknowns or like questions that I just didn't know or I'd never thought to ask. So hopefully this will bring some clarity for those who kind of feel the same way about that. Okay, so I decided to come off birth control myself back in the fall in November. And I just want to make a disclaimer that I don't think there's anything wrong with birth control. Everybody should have the option to choose. And I think, at some point in my life, I'm going to decide a different method that's going to work best for me. But don't take this as a one size fits all or that you have to come off birth control or birth control is terrible, because that's definitely not the case. I think everybody reacts differently and their bodies react differently. So you just got to find what works for you. And I think why we're doing this even is just having that education to know and be able to make the decision on what method is best for you, I think is so important. And that's what I personally felt like I was lacking going into it. Like it was something I was just given after like in high school or something as like a fix all, like, okay, just take this and you won't get pregnant or like whatever. And I was like, okay, that's what I want is to not get pregnant. And so I didn't really question it. And I didn't question my doctor because it was birth control. Everybody takes, or all women take it, right? And so I started to feel like I had symptoms of just being like anxiety, depressive. I just didn't feel like myself. And I've heard a lot of other women discuss this like side effect too, where it's like, I don't know how else to explain it, but I just wasn't myself. Like I was just always emotional and like not just like PMS emotional, just all the time. And then random, like my hair was falling out. I had stomach aches. I had like felt like certain food sensitivities. And so I decided once to come off birth control, but I didn't really do much research on it. And so ended up going back on the pill when I got with like my significant other. And then once again, I started like soon after feeling those same side effects and just feeling really irritable. And I wasn't myself. And so I was like, you know what, I'm going to like, I read Beyond the Pill and decided that like I was going to try to come off of it. And really my goal with it, kind of coming back to the point that, I don't think I'm going to forever be off birth control because I'm not ready to have a kid. So, I'm going to try to plan my future and, birth control helps with that. But for now, I wanted to figure out if I had a hormone imbalance because sometimes when you're on the pill, and why I'm here today and bringing Dr. Jenny into this conversation, you can either have like a hormone imbalance from the pill, or maybe it's like, at least what I was thinking, if you're having these fake hormones or synthetic hormones pumped into your body, it's kind of hard to know where the issue is and what the root cause is. So I decided to go off the pill again and start working with Dr. Jenny to try to figure that out and understand how my hormones play a part in my birth control method, and how I can either balance those and figure out if I do have an issue like a hormonal imbalance, and going back on a pill or whatever method I choose, I can be a little bit more aware of that. And I think not a lot of women know those things and don't have access to that information. And I mean, we all can do a Google search and like freak out over like WebMD, but it's probably not the best case. So I guess to kick off the conversation, I want to ask Dr. Jenny, just like in general, how birth control and hormones like play a part together.
yeah. And I should make a disclaimer as well that I fully support, women, whether they choose to be on birth control or not. It's a really important choice that you need to make for your body in your current situation. It can be incredibly helpful at preventing unwanted pregnancy. It's amazing at doing that. But where I think we get ourselves into a little bit of issues is where we're giving the pill to fix, our period problems or fix our hormones. And I think that's just false advertising. It's not necessarily fixing really anything that's going on underneath the surface. It can help get rid of symptoms and make you feel a little bit better. So there's absolutely a time and a place for that. But then when you decide to come off the pill at a later point in life, you're still going to have those existing issues. So, that's where I really just want women to know that they have choices, because you're sometimes 14, 15 years old going on birth control and you don't think you have any choices. So that's really where I think we're missing a link there, is just explaining not only the long-term effects of being on birth control, but some of the effects that you might notice being on the pill. And if I had $1 for every time somebody said, I just don't feel like myself, like while they're on the birth control pill, I would be making a lot of money. Let's just say that. And myself personally, when I was on it, I did not feel like myself at all. I was on the pill for 7 years and really just struggled quite a bit. And some people do very well on the pill and others do not. So I think it's just comes back to, you have to be able to listen to your body and figure out what's right for you. So, hopefully we can provide that piece of education. But how our hormones and birth control are linked is birth control is synthetic hormone. So it operates a little bit differently than the natural hormones we make in our body. But they also have a lot of similarities. So essentially throughout our cycle, we usually have a lot of fluctuations in our hormones. Estrogen, progesterone, and testosterone all fluctuate at different points in the cycle to help us ovulate in a healthy way, to help us prepare for pregnancy. Is Ultimately, that's the goal of your uterus, is to get pregnant. And if it doesn't happen, then you have your period the next month. So we're used to having a very cyclical fluctuation in our hormones. And when you come in and give the pill or the synthetic hormones, even though they're at a fairly low dose, being on a steady dose of hormones is not what our body is used to. It's used to that fluctuation. So I think that's where we run into a lot of concerns, is because all of a sudden we're on this flat dose of hormones instead of, being able to kind of ebb and flow as we naturally would. So even, throughout the time on the pill, you experience a lot of changes just because of that. And then trying to come off of it, your body has to kind of relearn how to operate without any synthetic hormones helping it out. So that's when, we can run into issues coming off the pill, is because your body's like, what do I do now? We've had help making hormones or having hormones in the body for however many years. And then you can have quite a few symptoms coming off the pill that are quite unpleasant if you're not, prepared to do that. So there are ways to support healthy hormones while you're on the pill, or if you're not on the pill. So there's definitely some options there.
Yeah, and I think coming back to the point too of like the root cause of things, or knowing like birth control can help, minimize some symptoms. Like I think for one of them, maybe it was like, I might be wrong, so sorry if I'm saying this wrong, correct me. But like PCOS or like really bad period cramps. So then they put you on the pill because it helps with that. And I think that's where it's like we can be kind of researchers of our own life. And it doesn't mean birth control's not right for you, but trying to figure out what that root issue is and understanding it before you choose a birth control method, I think is, like you're saying, that's where the gap is just kind of having that lack of information around birth control. And knowing your body to like, oh, like these cramps, not just how do I get rid of cramps, but like, why is this happening? So I think it's changing that narrative in our head too, to be a little bit researchive, if that's not a word, but research it and understand yourself and know your body.
Yeah.
So
I mean, to me as a clinician, it's important to know why you're having heavy bleeding or cramping or terrible mood swings. Is it because there's something underlying like PCOS or endometriosis or fibroids, or just, it's something as simple as an estrogen excess or progesterone deficiency, hormonal imbalance in that way. If we're not actually coming in at that root of the problem and trying to figure out, how can we mitigate this? And then we just put a pill on top of it, like, yes, you might feel a lot better. So that's absolutely a great time to be on the pill, is if, your period is making you completely miserable and you can't function. Like, yes, you need to get through your day and you need to not be in pain all the time. So, in that case, there's a great reason to be on the pill. But you should also be able to go a step further and being like, why is this happening in the first place? So that you can prepare yourself, because ultimately you're not going to stay on birth control forever. Like theoretically, there will be a day when you have to come off the pill, and you don't want it to be completely miserable. So if you didn't fix those problems in the first place, or at least figure out why they were happening, then you're just prolonging, and then when you go off, they're still going to be there, unfortunately.
Yeah, and I think that can kind of lead to our next question too, because I think knowing the root cause helps you understand, like when you're on birth control, I guess what to look for, what's maybe a red flag. But do you have any advice on how to like take care of your hormones or maintain your hormone levels while you are on birth control? I think specifically speaking, because it definitely depends on what method. So you might have to come back to that question in a sense too. But I know, let's just say like the most standard, I think, is the combination pill. So
Mhm.
in that sense, that has some of the most hormones, if I'm not mistaken. So how would you like suggest somebody take care of their hormones and just be aware of that while on birth control? If getting off the pill is not right for them right now.
Yeah. So a lot of the basics in just supporting your hormones in general are going to apply even while you're on birth control. So making sure you're eating a lot of healthy fats, because that's how we make most of our hormones, is from a fat base. So we need to get those in. We need to be pooping every single day, because that's the only way you get rid of excess hormones, whether they're synthetic or from your own body. That's the only way we get rid of them. So if you need to increase your fiber intake, if you need to drink more water, if you need to move your body, whatever that means, you have to poop every day. So that's why, like, number two, I talk about poop with everybody. You need to be managing your stress, because stress makes us pump out a hormone called cortisol, which negatively impacts our ability to make estrogen and progesterone in the right ratios and at the right times. So if you have a chronic, overwhelming amount of stress in your life, even while you're on the birth control pill, your hormones are going to be going crazy. So that's a really easy way. Well, not necessarily easy. It's hard to manage stress, but that's something I always advocate for, whether you're on the pill or not, because that helps us to create hormones in a healthy way. And nobody likes being stressed. It has a whole cascade of other effects. There's also certain vitamins and minerals that are depleted while you're on the pill. So usually I'll recommend women at least supporting themselves with that. Some of the big ones are B6 and B12, magnesium. So there's actual supplements that are targeted towards being a companion to birth control. I think there's one actually called OC Companion that I've used before, that just gives you all of the vitamins and minerals that are technically depleted by the pill. So you can kind of, squash any of those negative side effects that might be coming up. And really, the biggest point is just to make sure you're taking care of your body off or on the pill. Because if you're not eating in a way that's conducive to health, you're not moving your body, you're not managing your stress, no amount of birth control can save that. You can also, you can look into hormonal testing before being on the pill or a couple months after the pill, but technically, while you're on the pill, it's a little bit difficult to look at those things. So, if you want to investigate any of that before going on the pill or coming off, that's always a good idea. But essentially, making sure you're eliminating things properly, making sure you're eating a diet that's somewhat anti-inflammatory, not going to be causing you to be super inflamed and in pain all the time, and then managing your stress, and then supplementing with some of the key nutrients. Those are the big ways that usually I'll help support women while they're on the pill. And we have a lot more options if you're not on the pill too.
Awesome. Yeah, and I guess too, one question, we've talked about it a little bit, but to kind of bring it back to one definitive answer, um, what would you say, like, I know when I was dealing with it and I finally was doing the research to figure out like my side effects are, like what are some I don't know if I should call them red flags, but when should you, like, what are some side effects that you might have on the pill or any birth control, I guess, that maybe you should be questioning and asking, why is this happening? So I know we kind of said like really bad cramps or, being more anxious or having depression, maybe you didn't have prior to being on the pill. Do you think there's any other side effects that you can call out that maybe you've seen a lot of women have? Because I feel like that's where, like, when I started questioning them, I never had linked it to my birth control. I was kind of like, oh, maybe I'm in a toxic relationship and that's why I'm so like anxious or something. Or maybe it's because of this reasoning. And then I finally got to the point where like I had these like a list in my phone of like, okay, I'm feeling all these things. And sometimes it's people say it could be birth control. And so it was always like, it could be, nobody could ever directly say it. And I think that's where we come back to everybody is different and has different reactions. But are there any specific or side effects that come to mind that you've heard in the past that you can say like typically are linked to maybe a different root issue that I don't know, that could be like a birth control thing that you're like a side effect from birth control?
Mhm. So I would definitely say changes in your mood are a big one. And that's something that, unfortunately, a lot of women on the birth control pill end up getting prescribed either an anti-anxiety or an antidepressant as well, when a lot of the times they didn't have any issues to begin with before being on the pill. So it's kind of a, chicken or the egg situation. I'm not saying that birth control causes anxiety or depression, but it absolutely can bring that on in women who have never had it before, or worsen anxiety or depression in people who have had it. So to me, that one is big because that significantly alters your quality of life. If you go from not really living with anxiety to having to deal with it, that's a big thing to take on, and you have to weigh the risks of being, off of the pill, as as far as protection and pregnancy goes, versus, having significant anxiety and how you can handle that. So that to me is a big one I talk to a lot of women about. And not everybody is going to get mood changes while on the pill. Not everybody experiences that, but it is a big, big side effect. The big, like, dangerous side effect I usually warn people about is blood clots. Being on the pill, you are more susceptible to pretty serious blood clots that can ultimately be fatal if they're left unchecked. So typically I'll have women watch out for if their bruising changes, like if you bruise really easily while you're on the pill, if when you are bleeding on the pill bleed, you end up having a lot of clotting. If you have a family history of people with blood clots, like that's absolutely a big red flag. Like, birth control is not for you. And that should be something that's discussed with anybody who's prescribing birth control to you. But if for some reason you get on it and you start seeing changes there, then that's something that needs to be discussed immediately. So I would say watching out for bruising and blood clotting, and then watching out for anxiety, depression. Weight gain is an unfortunate side effect that a ton of women experience on the pill. A lot of women's breasts will get much bigger, which for some people is great, other people not so much. So you have to kind of, think about that. It's not necessarily a red flag, but it can be an uncomfortable part of being on the pill, is gaining a significant amount of weight. Typically that will come off once you come off the pill, but for some people that's kind of a deal breaker, understandably so. Um, and I guess the other big one that I talk to people about a lot is thyroid concerns, because going on the pill does change the way your thyroid starts to put out hormones. And because there's usually a lot of communication between our sex hormones, estrogen and progesterone, and our thyroid hormone. So when we have the pill in the mix, it can get a little confusing. So if you have any family members with issues like hypothyroidism, you start to experience like hair loss, weight gain, fatigue, dry skin, mood changes, any of those things can be related to your thyroid and need to be checked out, regardless of if you stay on the pill or not. So those are probably my big ones there.
Yeah. I was like struggling to ask that question because I didn't want to preface it as like all these bad side effects of birth control. But I think once again, everybody can react differently. So it's just important to have those top of mind where like I know some of my friends love the pill. Like they're fine with
Mhm.
it. It works great for them. They don't feel like they have a change in like mood or quality of life. Whereas like I just had a different experience. So I'm like, I don't know how to ask it because like every side effect might be different and it might not be linked to your birth control. But I think just knowing those and being aware of those was something I didn't know about before. And so I think just having that awareness helps, make your decisions, helps you make decisions better. And yeah.
Yeah. And I mean, we think of birth control as kind of like this benign substance that we're putting into our body that's just preventing pregnancy. And it can be in some people. Some people will never have a single side effect of birth control. Like, I envy those people, but they are out there. But then there's a lot of women who go on it and just feel really crappy and don't know why. And I'm like, okay, let's start investigating that. And it might not be their pill. It might be something else entirely going on. But I think we kind of just gloss over that and pretend that it's not an issue when it can be for a lot of women. You can also be on the pill for multiple years and then all of a sudden start reacting to it. I see that quite a bit. just because as we age, the way that we metabolize hormones, the way that we make hormones in our own body changes. So even if you've been on the same exact birth control pill for 5, 6 years, in year six, you could start having concerns with side effects, and that's completely considered normal on the pill. And I want people to know they're not like crazy if things like that happen to them. And there are still ways to navigate any negative symptoms that come up, even if you do continue to stay on the pill. There's ways to get around a lot of that stuff.
Yeah. And then a question too that even I've started to research now and being off the pill, or being off any form of birth control at this time, um, is what options you have. Because I think, there's the pill, which is like usually one of the most standard.
Mhm.
IUDs are becoming more popular, which personally, like I tried to get an IUD and when was unable to. So I think even just knowing other options beyond just like you can either get this or this, and like that's it, or like wear condoms, and that's a different side of like story, but still something that's important. So other than like some of those standard ones, or you could talk on the standard ones too, but like what are some options for birth control beyond just like the standard pill that we all typically know about?
Mhm. So, I mean, of course, the pill is going to be the most common. It's been around for decades, and women have been, I mean, for a lot of reasons, loving it. You don't have to worry about, getting pregnant. You have a fairly manageable period or withdrawal bleed while you're on the pill. So it can have a lot of benefits there. So I think it's a tried and true classic for a reason. People do benefit from it. So I mean, we obviously have the pill. You can do combination pill, which is estrogen and progesterone together. There are some people that are on what's called the mini pill, which is mainly just synthetic progesterone. That's for people who don't tolerate combination birth control. There is also the several different types of IUDs. So we kind of have contraceptive lumped into like permanent, semi-permanent, long-term, and then just spur of the moment contraceptive. So the permanent ones are going to be like your partner getting a vasectomy if you're in a heterosexual relationship. Vasectomies are fairly non-invasive. They're well tolerated. They're an outpatient procedure, but not a lot of men get them because I don't know, birth control is just left up for the women to decide, which I think is bullshit, in my opinion. But if you're at the point in your life where you're not looking to have any more children, or you just decide that you don't want them, then a vasectomy is completely viable option. Tubal ligation, getting your tubes tied, is obviously an option too if you're at the point where you don't want children. So those are kind of the more permanent options. Then we have the step down, so the pill, both combination and progestin only. And then we have the IUDs. So we have the copper IUD, which is non-hormonal, which is great for a lot of reasons if people don't tolerate hormonal birth control. But it is fairly large, has a risk of implanting into your uterus, small risk, but it's still there. And it can cause a lot heavier bleeding in some individuals. So that one is kind of, you have to weigh the options. If you want a lighter period or you want no period at all, I would not recommend going on the copper. But if you're opposed to being on hormones, copper is a great option, and it's very effective and can be left in for, I think some countries let you leave it in for 10 years. I think the US right now is 7. Can't remember off the top of my head. Then you have the bigger IUD like Mirena. It's going to be a higher dose of progesterone or progestin. Can stay in for up to 5 years. You don't have to worry about taking a pill every day. You might not experience any bleeding. I went on Mirena for a year and never had a single period, which to me is not a good thing, but for many people, that's a blessing to not have a period every month. Then there's the smaller IUDs. They change names all the time, but I think it's like Skyla, Kylina, they all have these like cute names, whatever. Those usually last about 3 years and have a much lower dose of progestin. So some people experience some bleeding in the middle of the month with that one, but overall pretty well tolerated, I would say. So those are like your major ones. And then obviously we can get into the contraceptive talk too. It's not just condoms, but condoms are definitely a big one. But I mean, there are absolutely other options out there. If you try the pill and you don't feel good on it, if you can't remember to take it every single day, there's also like Nexplanon, which is the one in your arm, or NuvaRing. They're a little bit less popular, but they're still options if you don't want to take a pill every day. So I mean, there's a lot out there. I think we're just not usually given the choice until we react really negatively, and they're like, "Oh, just try another pill," kind of cycle you through them. And if you're still feeling poorly after a lot of that trial and error, they'll be like, oh, "Okay, let's explore other options." But I think we should have access to the other options in the first place so you can make an informed choice.
Yeah.
That's just my opinion.
Yeah, and I've dealt with the pill thing where they're like, "Well, try this one. We could switch the pill you're on." And I'm like, "I just don't think this one's working for me. I don't think it's my option." Like, it just doesn't. Yeah, I'm gonna be sound like such a millennial or something, but it doesn't vibe with me. Like, it's not working, okay?
That's
Yeah.
fair. And I mean, but good for you for listening to your body and realizing that that wasn't a good option for you. There's so many women who just don't even think about that being a cause of the reason why they feel poorly. And they just are like searching for all these answers. Like, why am I feeling like this? Or they're just feeling miserable and never really come back to the fact that it could be, from this birth control pill. And maybe you should try another form of, a different type of contraceptive because
Yeah.
birth control doesn't work for everybody. IUDs don't work for everybody. Natural family planning or not using any birth control does not work for everybody. So you have to be honest with, where you're at in any, along that spectrum. It has to
Yeah,
be
and
work.
I've since, like, working with you too and, like, doing my own research, I feel like I've become, like, the annoying friend and people are like, "Oh, like, this is my side effect." I'm like, "You should ask why, like, what's going on? Let's, like, try, like, this." And I was like, "I need to calm down. I'm, like, not a doctor. I don't need to try to tell people what's going on." But, I mean, I don't try to diagnose them, but I'm just so much more passionate about, like, if they're like, "I don't know, I feel like this." I'm like, "You need to research it, why you're feeling that way, like, something's going on." But I just think it's so important, and that's, like, obviously what I always try to do with PYM beyond just birth control and, like, and all that, but everything for women is just having access to this information to, when you ask the question, be able to find those answers and be equipped to make decisions that are right for you and right for your health and your body, um, and you and your partner and whatever that is. So I think,
Yeah.
yeah,
I think that's
I
awesome you're asking those questions though. I'm so proud of you.
to my
But
friends,
yeah,
yeah, yeah,
we
like,
all
I'm like
need a friend like that.
even my like new roommate out here in California, she's like talked about this, and I'm like, it might be this. Like, you need to look. I'm like, here's this information. Like, look up on this. And I'm like, oh my goodness. But
I
I'm
love
just so
it.
passionate about it now because so many women are just like, oh, like that's how it's supposed to be. Like, oh, my birth control does this, or I'm just super this, and I'm like, no, it doesn't have to be like that. Like,
Yeah, I mean, we're just accepting like, oh, I guess I don't have to feel good. It's fine. Like you
yeah,
can still feel good and you can still feel good on the pill. It's just a matter of like, finding the right fit for you and then finding somebody who can help you troubleshoot things that come up along the way. Because again, coming back to this, there is a very valid reason to be on the pill. So like, I totally get it. So you just have to support people where they're at. But I think it's really important to advocate for yourself, keep asking the questions. And when I say advocate, I mean speak up when you go to your doctor's appointments. If you're not feeling well, tell them. You might be dismissed, especially if you are a young, healthy looking female, you will probably be dismissed. But, the
yeah,
more people that start standing up for themselves and start advocating and start questioning, the more the system can adapt, to be able to accommodate us wanting to be involved in our health and wanting to be feeling good. Like, we don't have to accept feeling like shit or not feeling like ourselves or not feeling anything. You don't have to settle for that. There are ways to make your life a lot better as long as you're willing to ask the questions and put yourself out there.
yeah, definitely. And I think too, that's like in my journey with it. Like I said, I'm already probably like considering eventually going back on some type of birth control method, just
Mhm.
because I'm not ready to have kids right now. Kind of doing long distance, so that's working out as far as the no birth control thing. Um, but thinking about that, it's like I'm still looking to go back on it. So I'm not anti, but with that, I've come off of it. And something we haven't talked about yet, but I also advocate for now is like using an app to track everything that's like been happening. And that's helped me know like how long my cycles are, the like random side effects that I may be having, or my bleeding patterns and like how heavy and not heavy. And so I definitely recommend. I use Flow. I know there's other apps out there, but that's helped in like kind of just my personal journey with it right now. Is I hope to meet with Dr. Jenny again soon and do a hormone panel now that I've been off of birth control for a while. And like my goal with that is I thought, being on birth control, I didn't really know what was out of whack. So I wanted to come off, get to know my body, and then do a hormone panel and see where I'm at. And then I can make a informed decision of what's going to work for me. And, or if I go back on a method or go back on the pill, if I start feeling a certain way, I can be like, okay, like I know this is because of XYZ, or I can, counter it with these lifestyle changes. So I think, yeah, once again, we keep saying that, but like knowing getting to know your body and asking those questions, I think is just important for everybody, even if you're a male. Like asking questions about your body and trying to research that is so important. And like I was saying, I think using an app has helped me just to see where symptoms are at and different things that I have going on in my body, and just knowing, I don't know, being more aware of myself and not having to always, I guess, be in the dark. Just being educated and knowing those
Yeah,
things is empowering, I guess, is what I'm trying to get to too.
it
It's like,
is. It's so empowering. Like once, I mean, you go on the pill and essentially you're not cycling like you would without it. So once you come off, it's essentially getting to relearn your own body and its patterns. And things might be a little irregular for a while if you come off the pill, but they will start to regulate. And the more information you can gather through an app, like I personally use Clue, but I like Flow as well, and I pretty much require all of my female patients to track their periods because it's as important to me as like your blood pressure or your heart rate or any other vital. Your period tells me so much about your health. And the more that we can learn about what's our normal, what's, regular for us, then we can feel really good about making decisions. Like you said, you can feel really good about moving forward, finding another type of contraceptive or even going back on the pill, but you're giving yourself the knowledge to make that choice, which I think is a really important and huge, and good job.
thanks. Yeah. Well, thank you for being here. Um, I guess we can wrap it up there, and we can, if you guys have any other questions about either birth control or hormones, like feel free to ask or reach out to one of us. And I can link Dr. Jenny's information. If you are local to Michigan or Grand Rapids area, I highly recommend her if you are looking for a naturopathic doctor to work with. Or just, even reach out and do a discovery call with her and ask some of those questions. So if this sparked any of your own, questions that you have, or you're starting to think about it, definitely reach out to her or do your own research. I think it's important to know yourself, and it's empowering to know yourself. So thanks for doing this.
Yeah, and if anybody has questions, you're more than welcome to reach out to me on Instagram directly. I'd be more than happy. I love talking about this stuff, clearly. So, as long as you don't have like specific medical questions, then I can absolutely answer them then. And then, like Alyssa said, I always do a discovery call if people are interested in working with me. But really, I want to support women wherever they're at in their journey. So, if it means you're on birth control and you're going to be staying on it, I'll support you that way. If you're looking to come off of it, or you're looking to go on it, we just have to meet where you're at and optimize, whatever stage you're at there, and can best support you to feel good throughout that and throughout that decision making process.